In this video, I'm going to show you how to place a bandage after a Hock arthroscopy. So we're going to have some small incisions, probably at the front. There might be one or two at the back as well. You're going to want to have your bandage covering that up. Keeping this bandage on is one of the most important things for making sure that your horse does not get an infection after the surgery. So we really want to make sure that bandage is clean and on so the incisions stay clean until the sutures come out. So we're gonna use our Telfa, which is a non-stick bandage. It has a shiny side and a non-shiny side. We're gonna put the shiny side against the sutures. You're gonna follow the directions of your surgeon, but most times I don't have people put anything on as far as a dressing or an ointment. We're gonna put just this clean, dry Telfa directly on those sutures. And then we're gonna use our conform to hold that on. So you're gonna make sure that that Telfa is anywhere where you have sutures. And then we're gonna hold it on with this conform. We're not pulling with this conform, we're just laying it on directly over the Telfa to hold it on. And we're going to go all the way around. We're going to go around the point of the Hock so that a little bit of it stays open because we don't wanna have any pressure over the point of that Hock. And then we're gonna go all the way down just to cover up that Telfa and hold it in place. And we can cut it. And then we're going to use what's called Elasticon or Elastisport. And it has a sticky side. It's very sticky. It's going to stay in place. With this, we don't want to put too much pressure on it because you can with this by pulling it too tight. So we're going to start above our conform layer, lay it directly on the skin. We're going to pull it out as we go so that we can just lay it gently on. And with the first layer, the first wrap, we're going to go all the way around the leg and back on itself so that it makes a full circle. That's the best way to make sure that it doesn't slip down. And then we're going to continue on down, overlapping it by about half each time. So that we go all the way down over the Hock. And every time we go around the leg, we want to pull it out and lay it down gently so that we're never pulling or putting pressure on it as we're going around the leg. Again, we're going to leave that open place over the point of the Hock so that we don't get any pressure there. And it just needs to be a small open place there. And we're going to keep on going down, overlapping our bandage each time by about half. And like I said, as a owner or trainer, wrapping this after a Hock arthroscopy is one of the most important jobs because it is really going to make the difference in keeping our incisions clean and making sure that we don't end up with an infection afterwards. So we're going to go all the way down so that we cover up all our conform. We generally use a full roll of our Elasticon, and so that at the bottom we have it just on skin so that it is preventing any dirt from getting up into our bandage. And then she's going to flex it at the end and open it at our slit. And if you do have incisions at the back, it's usually a good idea then to cover up this slit with some Liplast so that you don't have anything able to get in the back of that bandage.